Hi everyone, welcome to the gender training course. I'm Nozomi. I'm social scientist in charge of gender integration in plant health initiative. This is the first class of the training course. Let me introduce participants. 102 participants registered and they are divided into 3 groups. Participants' expertise are plant pathology, agronomy, entomology, social science, and other various subjects. Participants are from 29 countries, 8 CG centers, and 25 partner organizations. All welcome. During the registration process, I asked about your work. There are 2 participants who wrote about why gender is important for plant health. Let me share it. The problems and solutions associated with pests and disease are perceived differently between men and women for different reasons associated with their gender roles and decision-making. So it is necessary to propose management solutions with a gender perspective through design, validation, and extension. Another participant said that women are one of the main driving forces in post-harvest activities, but their interests are not specifically considered in scaling strategy. The main question is how to take into account gender aspect in design and sustainable scaling strategies for plant health innovations. Wow, those 2 participants already passed the exam and I could give them a training certificate. Excellent. For other participants, please don't worry. This is first session and it's for beginners for increasing your gender awareness. Some people ask me, Nozomi, please give me a gender manual so that I can just follow. Unfortunately, there is no such a manual to address gender. That is why CGIAR and we are struggling to address gender for a decade. Because the cultural context vary and your focused innovations are different, we need tailor-made strategies accordingly. What you need is a critical gender lens and critical thinking, which now I'm going to explain. Let's look at the world with a gender lens. By the end of this presentation, you will see the world differently. After the presentation, I will ask you what you learned. So please take notes. The world without a gender lens looks like this. Here, we use general terms such as farmers and don't care their differences. The world with a gender lens pay attention to difference, diversity, and power dynamics among the farmers, which allow us to provide diverse options for technology and scaling strategies. Before talking about gender and agriculture, let's look at public toilets. Are gender perspectives incorporated? Women spend a lot of time on waiting in a queue in a public toilet. Why? Because architectures are designed by men from men's perspectives. Women need more time and space in the toilet than men because of their biological constitutions, their gender roles of taking small children to the toilet, and women's dress or clothing designs. Yet, architectures are designed without a gender lens, and space are often evenly divided. Research shows that women's toilets need 3 times more space than men's. Despite huge inconvenience, women themselves don't question about it because many people don't have a gender lens. This is an example of why we need a gender lens. Incorporating gender perspective is a good thing for men too, because men don't have to wait for your partner or a female friend in front of their toilet in this case. How about the agriculture sector? Are women's perspectives incorporated? Agricultural innovations are designed from men's perspectives, just like public toilets. Evidence suggests that machines, hybrid seed, and digital technologies have higher adoption rates for men than women farmers because women's perspectives are not taken into account in both technology design and dissemination strategies. Here, I want to emphasize that plant health innovations may contribute to reinforcing gender gaps instead of reducing it. Plant health innovations are so far inefficient because they neglect the half of potential users. What can we do? We need machines designed for women, subsidies for seed for women, and priority distribution channel for women. For the digital technologies, forming a women's group to share a smartphone and information can be one of the strategies in some context. Now we move to more specific examples related to pests and diseases. Let's learn from failure cases. This example is a cassava disease from West Africa. This is relevant to breeders and plant pathologists. The spread of disease was a serious issue, and replacing with a new disease-tolerant variety was considered as part of solution. So breeders recommended, this is the best tolerant variety. You should replace this with your variety. Yield is also high. But women farmers said, no thanks, yours is not suitable for processing. Technologies and innovations always need to be developed with consultation of women as well as men farmers. Key question to you is, have you identified women's specific preference, incentives, and interest for your plant health innovations? The next case is from Vietnam, Southeast Asia. The transpondary sweet potato foot rot disease had arrived to this country and seriously affecting right now. PCR and LAMP methods are available to diagnose this disease. Dr. Plant Pathologist asked, hey, Mr. Extension, please collect the sample with symptoms. The extension workers goes to the field and only talk with male farmer representatives. Hey farmers, have you seen these symptoms? Male farmer representatives are farm managers who rarely go to the field. They said, mine is doing well and no problems. If you ask female field workers, we could find the symptoms much earlier. Key questions to you are, what are knowledge gaps in the identification of disease among researchers, extension workers, and farmers? What are alternative communication tools to reach out farm workers who are frequently in the field? Okay. This is the last case is from East African highland. In this region, banana is traditionally grown by men, and training for banana is always provided to men. However, women grow beans by using banana stem as a support. Here, if the training was only provided to men, who are often even absent from the village, it is extremely inefficient. Let's read. My husband's banana are sick. My beans are fine. Her husband left home saying, please look after my bananas, bye. If women are trained, she could ask her husband by phone, hello, my husband, I cut your bananas because they are sick. In this way, training to women and their communication with their husband was a key for implementing control measures. Key question to you is, do you know crop-specific gender roles and decision-making? If not, we need to do this first before developing our training tools and training designs. So what can you contribute to gender integration as plant pathologist, entomologist, agronomist, and as a biophysical scientist? I would like to introduce interdisciplinary approaches. In the current disciplinary approaches, As biophysical scientists, you look at relationships between crops and pathogen or crops and insects. You consider heterogeneous farm landscapes for designing control measures and tools. But heterogeneous farmers, especially gender-differentiated needs and capacity, are not fully considered. Agriculture sector is still male-dominant, and without this gender consideration, it will be disseminated to male extension workers and male village leaders and male farmer representatives. This is a current status. Although some crops or technologies are women-oriented, they are rare cases in plant health innovations so far. Please remember that without gender consideration and interdisciplinary collaboration, you are likely to naturally support men and their interests. In contrast, interdisciplinary approaches involve all stakeholders from the beginning and develop and design technologies by reflecting women farmers and other disadvantaged people's needs. Here, I highlighted NGOs and community workers who can reach to women better than the traditional extension systems. Key question to you here is technology to whom, for what? From diagnostic tools to scaling for equitable impact. The interdisciplinary team work together with one framework, and we all need to be responsible for achieving equitable and inclusive impact. Now I ask you 3 questions. What are the goals of agricultural development? What do you want to change? Who benefit from your project? Are you still in crop-oriented focus? Production, or can you move to human-oriented goals for equitable distribution of technologies? Please remember that the issue of poverty is not only about lack of production, but more importantly, about unequal distribution of technologies. It is important treating women as the primary user group because currently women are secondary user group in plant protection. Prioritizing crops, varieties, technologies that are important for the marginalized users, those 2 aspects can make a big difference in the world. Have you got a gender lens? Now I suggest some interdisciplinary research questions to you and your entire team. How does the pathogen spread to diverse ecological and environmental landscapes? This is a crop-oriented research question without a gender lens. Let's put gender lens. How do socioeconomic and political factors influence identification, prevention measures, and rapid responses in farming communities? This includes which regions or which communities are more vulnerable to the disease due to socioeconomic conditions that delay in identification or prevention responses. Remember that COVID spread in the vulnerable and more marginalized communities. Risk maps need to include socioeconomic vulnerabilities and their priorities. Second question is what are the levels of knowledge and perception about the disease best among women and men farmers and extension workers? Are their knowledge and perceptions the same as yours? So now I proposed adding 2 questions with the gender lens. This absolutely enrich your research and intervention in terms of efficiency and equity. The second topic is what are incentives and constraints for farmers to adopt the innovation? This is a question without the gender lens. You go further. What are specific incentives and constraints for women and men farmers related to their gender roles and decision-making? What are the best communication means for women and men farmers? The third last question is how does innovation contribute to improving crop productivity and incomes? We could add who are more likely to adopt your innovation and why? And why has the innovation been failing to reach out women and disadvantaged farmers? Have you got a gender lens? Now you can go to the next step to look at other social identities. I mean gender plus other social disadvantages. There are specific constraints derived from other social identity on top of gender, such as indigenous people who have different culture and language, or young people, youth. But again, if you don't have a gender lens, women become the secondary importance. Please put a gender lens first and then look at other identities, like this. Similarly, when you look at household representative, women are often forgotten. Please look at household typologies such as those who have wife and husband, non-husband, migrating husband. If you have specific strategies for those specific groups, then we can reach to many more people. This is the end of presentation. Thank you for listening. Next session is 12 September. The topic is data collection tools, data gaps in plant health innovations. Now you do exercise 1. What was the most important message you learned from the presentation? Please write one sentence in the chat box in the Zoom now. If you have questions, you can also write questions in the chat box.